Alterations in cognition and sensation, pathophysiology, and management. First of all, we're going to look at the anatomy and physiology of the eyes. Those intraocular structures include the eyelids, the eyelashes, and tears. All of these are designed to help protect the eye. The canthus is where the eyelids meet. It's usually horizontal, although the Down syndrome client will have a diagonal canthus. The epicanthal fold is going to be found in the Asian population. So we can have an inner canthus, which will be at the bridge of the nose, and the outer canthus. Blinking will clear dust and particles from the surface of the eye. The eyelids actually help adjust the amount of light that enters the eyes and distributes tears. There are multiple glands. The conjunctiva will line the lids. The caruncle and the lacrimal apparatus are all parts. Tears are composed of water, sodium chloride, and lysozyme. Intraocularly, we have three layers. We have the sclera, which is considered the white of the eye, and it's going to protect the structures within the eye itself. It connects to the cornea, which covers the anterior portion of the eyeball, the anterior chamber, and the pupil. The uvea is the vascular coat of the eye. So we have the choroid, the iris, the pupil, and this produces aqueous humor that nourishes the eye. Vitreous humor is going to be a gelatin that supports the shape of the eye. And finally, we have the retina, composed of rods and cones and the macula. True or false? The eyelids, eyelashes, and tears are responsible for clearing dust and particles from the eye surface. This is false. It's blinking that does that. True or false? Rods and cones are located in the retina of the eye. This is true. For visual function, light is going to enter the eye and then it's transmitted by nerve signals that are interpreted in the cerebral cortex. Refraction is the bending and slowing of those light rays that enter the eye onto the retina, where those rods and cones will then send the image to the visual cortex for interpretation. Accommodation is the lens changing shape to focus on an image, which helps allow near and far vision. Near point would be the closest point that a person can clearly focus. When we are assessing the eyes, we need to get the client history, allergies, vision changes, discomfort. Do they wear corrective lenses? Do they use eye medications? Have they had eye trauma, disease, or surgery? What is the family history of eye disease? We will then assess the external eye appearance, the pupil responses, and eye movement, the symmetry. Do they have ptosis, which is drooping of the upper eyelid, or protosis, which is the upper lid that does not close appropriately? Nystagmus is uncontrolled oscillating movement of the eye. Is there inflammation or exudate from the eye? Do they have a history of vision changes or injury, discomfort, medications, or allergies? We can do visual screening tests, which would include that Snellen eye chart, the one that has the the large E on it and all of the different letters. We could do the Jaeger chart, the Rosenbaum Pocket Vision Screener, which will test for near vision. The Ishihara polychromatic plates will help determine color blindness. And we can test the extraocular muscle function test with the corneal light reflex test that shows us eye alignment. We can uncover test, which will show extraocular muscle function. And the positions test will test eye muscle strength and cranial nerve function. True or false? The Snellen chart assesses for color vision. This is false. Although there are some Snellen charts that will have a red line and a green line on it that can give a very basic color acuity interpretation. Different studies that we can do include ophthalmoscopy, which is examination of the fundus of the eye, retinoscopy, which helps determine the focusing power of each eye. Tonometry will measure intraocular pressure. Normal intraocular pressure is 10 to 21 millimeters of mercury. We can do a visual field examination. This will help us test peripheral vision and any gaps in it. We can do the visual field change associations to test for glaucoma, stroke, brain tumor, or retinal detachment. We can do color vision testing, which will determine the client's ability to differentiate colors. We can do the Amsler grid, which lets us know if there are any macular problems. The slit lamp examination will magnify the surface of the eye and helps identify any corneal abrasions, iritis, cataracts, or conjunctivitis. A retinal angiography will help show vascular changes and the blood flow in the eye. Ultrasonography would be used when the posterior of the eye is difficult to visualize. And retinal imaging uses high resolution, so pupil dilation is not necessary for this test. Now let's look at the ear. Ears have two functions, hearing and balance. And speech development will be dependent on the client's hearing ability. There are three subdivisions of the ear. We have the outer ear, the middle ear, and the inner ear. The outer ear consists of the auricle, and the middle ear transmit and amplify sounds that is conductive hearing. This consists of the pinna, the external acoustic meatus, and the tympanic membrane. The middle ear contains the eustachian tubes, the malleus, the incus, and the stapes. The inner ear, or the labyrinth, is stimulated by sound waves and head position or movement, and this helps maintain our balance, which we also call our sensorineural hearing. This consists of the cochlea, the semicircular canals, which are what deal with balance, the uh, vestibulocochlear nerve, or the cranial nerve 8, and the organ of Corti. So where is the pinna of the ear located? What part of the ear? This will be the outer ear. When we do ear assessment, we can do the basic auditory acuity tests, such as the whisper test, which is a very simple but gross auditory acuity. We stand behind a client a couple of feet away and we whisper a word, having them cover one ear, have them cover another ear. We whisper another word and see if they're able to hear it. We can do otoscopic examinations, which will examine the external acoustic canal and the tympanic membrane. We can also do the tuning fork test. This will assess the conductive or sensorineural hearing loss, and this would consist of the Wren test and the Weber test. The Romberg test is the test that shows us the client's ability to sustain balance. Different diagnostic studies would include audiometry, which is a precise measurement of hearing acuity, and it's measured in decibels. The lowest perceptible sound is perceived at 20 decibels, and a painful sound level is at 120 decibels. We can also do a caloric stimulation test for nystagmus, which will help measure the vestibular reflexes of the inner ear. We can do electronystagmography to test vestibular function, and this would be used in conjunction with the caloric stimulation test to measure duration and velocity of eye movements during nystagmus. And then we look at the nervous system, which consists of the brain, the spinal cord, and peripheral nerves. It coordinates and regulates all body functions and responses to stimuli. It will receive and interpret information from the external environment and initiate responses to received information. There's two main parts to the nervous system: the central nervous system and the peripheral nervous system. The central nervous system consists of the brain, and we have different parts of the brain. The cerebrum, which consists of the cortex. It's responsible for movement and the motory sensory neurons. It contains two hemispheres, which are divided into four lobes: frontal, parietal, temporal, and occipital. Pyramidal, this is where it goes to the brain stem and spinal cord, and extrapyramidal would connect to the motor neurons in the spinal cord motor pathways. The cerebellum will control and coordinate muscle movements, while the brain stem deals with the respirations, the heartbeat, and the vasomotor activity. This would consist of the midbrain, the pons, and the medulla oblongata. We also have the corpus callosum, the skull, which is made up of rigid bones, and the meninges, which cover the brain itself. Around the meninges, we have different membranes. We have 4 different layers. The dura mater is the outermost layer. The arachnoid would be the middle membrane. The pia mater is what adheres to the brain and the spinal cord. But then we have that subarachnoid space, which is between the arachnoid and the pia mater. Within the brain, we have ventricles, which manufactures and absorbs cerebrospinal fluid. Its function is to protect structures like a shock absorber, and it also helps maintain a constant intracranial pressure. The spinal cord is a continuation of the medulla, and it's protected by the vertebrae. It ends between the first and second lumbar vertebrae, covered by meninges, and provides centers for reflex action. It's also a pathway for impulses to and from the brain. And then, of course, we have the vertebra, which is going to protect the spinal cord itself. What part of the brain controls breathing? This is the medulla oblongata. The peripheral nervous system consists of all of the sensory and motory nerves outside the CNS. These structures include the cranial nerves, the spinal nerves, and the sympathetic and parasympathetic nerves. The cranial nerves, there's 12 pairs. We have types 1 to 12. In the spinal nerves, there's 31 pairs. We have the dorsal nerves, which are sensory, and the ventral nerves, which are motor, and dermatomes. This is where a spinal nerve root innervates a specific area of the body. So it's kind of the pathway of the spinal nerve. The autonomic nervous system consists of the sympathetic and parasympathetic nervous systems. Its function is to stimulate or inhibit smooth muscle, cardiac muscles, and glands that are essential for survival. The sympathetic nervous system is released during stressful situations. This is what we call the fight or flight response. Our emotions, severe illness, and danger are going to result in the release of catecholamines. And if you recall, those catecholamines are epinephrine and norepinephrine, and then also dopamine. The parasympathetic nervous system will conserve body energy. It slows down the heart rate, allows us to digest our food, allows us to eliminate body waste. And this is where we see the acetylcholine and acetylcholinesterase. So which of the following responses indicates sympathetic nervous system activation? This is the tachycardia and dilated pupils. So to assess the nervous system, we need to get a good history. Was there any trauma? What's the drug history? Family medical history? How are the speech patterns? Are they normal or are we seeing any deficits? What is the client's mental status? And is it normal for the client or is it abnormal? What is their intellectual functioning and reasoning ability? And extremity strength and movement. Their physical exam, we're going to look at their body posture. If you look at the picture in your slide, this is going to indicate damage to the brain, and we have abnormal posturing. And we'll talk about that here in just a minute. But body posture is going to be very important to assess. We could also assess the cranial nerves, although nurses don't often do that part. We can assess motor function. Do we have atrophy of those large muscles? Are the muscles in strength of equal size and strength? And what about their gait? How do they move and do they have good balance? We could also do the Romberg test here. We want to look at impaired cerebral function, and this is where these pictures really come into play. We have the decorticate posturing, where the arms are flexed, the fists are clenched, and the legs are extended. The decerebate posturing, the client has stiff and rigid extremities. It's going to be more severe than the decorticate. And flaccidity, where there is absolutely no motor response at all. We also look at sensory function. Excuse me, do they have a sensitivity to heat, cold, touch, and pain? What is their level of consciousness? Make sure you classify it appropriately. Are they conscious? Are they somnolent, stuporous, semi-comatose, or comatose? And we can determine that somewhat through the Glasgow Coma Scale. Parts of it include their eye-opening ability, their verbal response, and their motor response. We could also use the Rancho Los Amigos scale. which is actually a more flexible tool. We need, excuse me, need to assess the pupils. We're looking at the size. Are they equal or unequal? Are they dilated or pinpoint or somewhere in between? And how do they react to the light? Do they respond appropriately when light is shown in the eyes? We also check out the neck. Is the neck stiff, or are they holding it in an abnormal position? Is it rigid? And what are their vital signs? Do we have a sudden increase or decrease? This could indicate some CNS disorders. Different tests that we can do would be our computed tomography or the CT scan. We can do it with or without radiopaque dyes. We need to make sure they don't have an allergy, though, to iodine or shellfish. We can do the MRI or the PET scan. This is going to help identify the metabolic activity of the body's structures. We can do the SPECT scan, where it will help identify the brain's cerebral blood flow and the status of those receptors. Really good to help identify Alzheimer's and Parkinson's. We could also do a lumbar puncture or a spinal tap. Excuse me. This is going to help identify any pathogenic microorganisms. Normal should be clear and colorless, and we should have a CSF pressure of 80 to 180 millimeters of water. We can do some contrast studies with the cerebral angiography, which will detect distortion of cerebral arteries and veins and aneurysms. The EEG, or the electroencephalogram, shows electrical impulses generated in the brain. It kind of lets us know if there's any brain activity. Nerve conduction studies can identify nerve injury and compression, such as with the carpal tunnel syndrome or peripheral neuropathies. And we can do the echoencephalography. Excuse me. We need to be concerned about the diet that we are administering our clients, especially if they have some neurological deficits. Their diet for dysphagia may need to be pureed or ground or soft, or maybe just a modified general diet where we're not giving the client anything really difficult to chew or swallow. We may need to provide some commercial thickeners or nutritional supplements or tube feedings to assist in the client's nutritional status. So the nurse is assisting the client to prepare for a lumbar puncture. Which of the following actions should the nurse take first? We need that client to be positioned on their side.